Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elseygood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. Today's show is sponsored by the Poway Integrative Medicine Centre, who taken a holistic approach to providing the highest level of healthcare, combining internal medicine with alternative therapies, including acupuncture and Chinese medicine. If you're in the San Diego area, they'd love to see you. Or if you're in the state of California, they offer secure video conferencing appointments when clinically appropriate. Go to PIMCHEALTH.com or call 858-312-1672. On Facebook, follow Jill Cottel, MD's page. Well, hello, Jill, and thank you very much for joining us today.
Hi, Linda. Thank you for having me.
It's always such a pleasure and an honour to speak to you. And for those people that perhaps aren't aware, you're one of our medical advisors. And we had a lady on Facebook who says she's a patient of yours and that you're absolutely wonderful. And if you're in the San Diego area or near, see her, she says. And I won't say her full name, but it's Whitney. Yes. So.
Oh, thank you, Whitney.
That's really nice. So I'm hoping that she's listening today. So, what have you been doing since we last spoke to you?
Let's see. Seeing a lot of patients and chasing down my teenagers. Well, they're kind of both full-time jobs.
But teenagers grow up quite quickly.
They do. They do.
It's
and they're good kids.
Oh, good. I mean, it's lovely when they're small, and at the time you think they're going to be so demanding forever, and then time just flies by, and that period is gone, hasn't it? You know, it goes very quickly. So the patients that you've been seeing, are they people with autoimmune conditions? How many would you say, on average, a week, new patients with autoimmune conditions do you see? Is it a common thing?
It is now. It used to be before I was part of the LDN community. There weren't as many. And then the more patients I've seen who have autoimmune conditions, it kind of has led to more patients coming in. And I think being involved with the LDN Research Trust, I see more than I would. So I do see quite a few number of patients with autoimmune diseases. I would say, but out of the new patients that I see coming in right now, we're treating more patients for alcohol-related disorders, actually with the higher dose, than autoimmune right now.
Oh, okay. Interesting. And what results are you having with the full dose naltrexone on? We used to say alcoholics, but it's now, what's the new name for it?
Alcohol use disorder.
Aha, yes. So how's that been?
Very good results. Very good results. And just did a review of the literature, which will be coming for the September conference. But yeah, that's been exciting. So we're still getting the autoimmune patients, though. I had a wave of patients who were coming in for thyroid conditions. That was a few months back. And I think it coincided with Dr. Wentz's presentations that she did.
Oh, right. And
that's tapered off a little bit.
Okay. But, I mean, there are people being diagnosed every day, unfortunately, with an autoimmune condition or cancers. How are you on cancer. Do many of your patients have cancer who come to you?
No, I've only had just a few patients who had cancer come in for LDN, and it's only been fairly recently, so I haven't really had the benefit of seeing how they do long term.
Mm-hmm. Okay.
So that's something that I don't have a lot of experience with.
Okay. Well, we have several questions that our listeners have wanted you to address. Are you ready to start?
I am.
It will be easier for you to read them because some of them are very long and I wouldn't know which parts are relevant to read out. So it'd be easier if you read them out, if that's okay with you.
Okay, that works.
Okay.
All right, so first question comes from someone who says he had a serious accident in 1982, left him with a amazing super pain disorder. And he had been on fentanyl patch at 200 micrograms and then went to taking low dose naltrexone just June of last year. And he said he'd been disappointed with the lack of results. He started with 3.5 milligrams and then has been on 4.5 milligrams. And his question is, should he be looking at increasing the dose? And will there be a difference going past the 4.5 milligram level, or is this the best you can expect from LDN? And that's a good question. The short answer is that going higher than the typical low-dose naltrexone, which should be usually considered around 4.5, it hasn't been studied as well. So we don't know. That's the short answer. I don't have... The majority of my patients are not above the 4.5 milligram dose. I have two patients who are taking a higher dose, and one of them, she has fibromyalgia, and it was because she saw a doctor who typically treats in the higher dose range with naltrexone. And so she came to me, I want to say, on 15 milligrams of naltrexone or so, and I actually initially put her back down to 4.5, and she took that for a while and didn't feel as well, and so she actually ended up going back up to the higher dose, and that's where she's been since she's been my patient, and she's been comfortable and stable there. The other patient I had has psoriatic arthritis, and she had gone into remission at the standard low-dose naltrexone dose, and then she after a year or two, she went out of remission, and I sent her to an integrative pain management clinic where they're familiar with LDN, and they actually doubled her dose and took her to 12 milligrams, and she went back into remission. So those are the only two patients that I have experience going above 4.5 milligrams. I did just have a patient come in fairly recently, and she had been on the forums talking to patients who have central pain syndromes. And specifically in that patient group, other patients were reporting that they were getting more pain relief going above the 4.5 milligram dose. So I'm not on the forums, of course, with the other patients, so I can't say, I can't say specifically what other patients were saying, and, you can only tell so much from forums, but that was her impression, and based on that, she wanted to increase her dose because she wasn't getting the results she wanted. And so with the understanding, that hasn't been the way it's been typically dosed, she's increasing her dose little by little, and she hasn't been back in yet. She's got a follow-up appointment coming in. So the answer to your question, I guess, would be if you're not getting the results that you want at the 4.5 milligram dose, if you're not getting pain relief, there's not really any downside to increasing the dose other than maybe it wouldn't work, in which case, you can put it back down. So that's about the best answer I can give to that question. I'm sorry, I don't have more personal experience with going higher on the dosage, and there may be some other prescribers who do.
Well, I hope that answers your question, Stephen. From some of the doctors that I have interviewed, it would seem some of those will increase the dose higher, typically like 6 or even up to 10, and there have been 1 or 2 who have gone higher. By increasing it, as you were saying, slowly to find out how you tolerate it. Years ago, there was a doctor who would always try and find where the patient hits their opiate blockade. And some people reach that earlier than others. And when I asked him how you know you've reached it, he said, because you feel completely flat. You don't feel well. You feel as though you've hit a wall and you know it. And then he used to get his patients up to that and then drop it by 0.5, and then they were fine. But
that's interesting.
Yes, he's the only doctor that I know who explained it in that way. But there are doctors that do use a higher dose, and like you said, it's not going to harm you, and it might just work. So maybe give it a go, Stephen. Who knows? It might do something. And if it does, please let us know.
Yes, for sure.
Do you want to ask the next one?
Sure. Second question. The patient has Sjogren's. And the question is, I had great results from LDN, but can no longer tolerate the GI side effects. Do you have any suggestions? And basically, she developed, it sounds like a terrible case of vomiting, reading through this. And reflux medicine was not helping, and she had the vomiting for 6 months and had daytime nausea and addressed everything else, and nothing else fixed it. So she ended up stopping the LDN because that was the only thing left to change. And the vomiting went away, but then the joint pain returned. And then eventually, let's see, I think I read that the dry eyes and the dry mouth got worse. So her question was, she was trying to go down to the tiniest dose that she possibly could, almost emptying the capsule, and then the vomiting would come back. And so her question was, what to do at this point. And what I was thinking was, if she could get the compounding pharmacy to make up the LDN liquid, so then you're eliminating a couple other variables. It's just the naltrexone plus water is all it is. And you can get it made up in 1 milligram per ml, and start off you get the dropper and start off at the tiniest dose, like, a tenth of an ml, which would end up being like 0.1 milligrams, and see if just at that tiny of a dose it's going to cause vomiting. And if it did not, then you could just increase it really, really slowly, by just like a tenth of an ml at a time, and just see if you can find a point at which you come to a balance where it's not making you vomit, but you can get some amount of pain relief from it. So that was my thought as far as that went. Linda, I don't know if you've seen patients who have had vomiting as a side effect.
People with GI issues, Dr. Jill Smith, who did the Crohn's studies, found that if people had sublingual drops, that it absorbed, bypassing the stomach, and that eliminated all GI problems. So that might be a solution for this. I don't know whether it's a lady or a man. This person.
She said there was a problem getting the sublingual form of LDN in New Zealand.
Okay.
So I don't know why that would be. Because isn't the sublingual just the naltrexone plus water, or is it something different?
I'm not exactly sure, but I have to find out who it is, and if it's a compounding pharmacy, they should be able to do the sublingual without any problems. Anyway, and
I would think so.
Yes, I do know some pharmacies who would actually ship there. So anyway, we will, if she would like to try the sublingual, we will find a way of getting it for her, or for her to be able to get it where she lives. But
wonderful.
Yes, I'm sure there is a way around it. And if she had the good benefits with her dry eyes and her pain, it's certainly worth trying to find a way around it to be able to continue taking it. So we'll help you. I'll contact you after the show.
Wonderful. Perfect. All right, let's see. Question number 3. A patient says, I have MS, and she's taking 3 milligrams a day on the low-dose naltrexone. And there's 3 parts to her question. The first part, she says, today I had double vision. Should I ask for a higher dose of LDN? So I just wanted to remind patients, if you have double vision, you should see your doctor. If this is a new finding, you never want to just assume it's coming from one thing. But the second part of that, going on to the higher dose of LDN, I would say yes, because the MS studies have used 4.5 milligrams. Is that correct, Linda?
Yes.
Yeah. So I would go up to the 4.5. And the other thing she mentioned at the beginning was that she was taking it in the morning and possibly moving it to the evening dosing. There's a lot of controversy about morning and evening dosing, but there's a theoretical possibility that maybe it works better in the evening. And with MS, it's serious enough that probably trying it in the evening would be something worth looking at, unless you just can't tolerate it at night at all. And she didn't elaborate on that, she didn't elaborate on that, so I'm not sure about that. The second part of the question was, she saw a YouTube video on using vitamin K2 for multiple sclerosis. And her question was, when LDN shuts off MS, will K2 rewrap the nerves? So I looked this up, and there were 2 small studies I found, both in animal models. I think one was an animal model and one was a cell line, looking at vitamin K2 and its activity on the anti-glial cells. And from what I can interpret from the studies, because they're very technical, it looks like maybe K2 was working in a way that might be inhibiting inflammation coming from the anti-glial cells, microglial cells. So, but that was the first time I'd seen that. And so would K2 rewrap the nerves? So could you have healing, I guess, would be the question. And that's a more complicated question. So technically, in terms of would the K2 directly rewrap the nerves? No, because the mechanism that they're looking at is inhibiting the glial cells. Could your body heal itself on its own once the anti-glial cells or once the microglial cells are inhibited? That's a different question, and we think so, but to a certain extent. Linda, would you agree with that?
Yes.
Okay. Part 3 of this was inflammation is the enemy. Is there a way to shut it off? I ordered a book on the Mediterranean diet. Would that stop the inflammation? And I would say yes and yes. So Mediterranean diet is a very good one for anti-inflammatory diet. And it's a very good question because diet's a very important part of treating autoimmune disease. I think all our prescribers would agree with that LDN it's not a single thing that will fix an autoimmune problem. It has to be a comprehensive approach, and diet is definitely important. And the more anti-inflammatory diets seem to do better. Do you have any comments on that, Linda?
I would say the biggest change I noticed was going gluten-free and dairy-free. Getting back to the first question, where the lady had problems with reflux and acid and vomiting and things, I used to have to take an anti-acid every day. If I didn't take it, when I lay down at night, it burnt the back of my throat. I'd wake up and I could actually make myself wake up vomiting because the acid. And when I went to one of the conferences in Chicago, 2 doctors were talking to me and asking me what medications do you take? And I can't even remember the name now as this antacid. And they said, oh, it's really not good to take every day because it doesn't just affect the acid, it affects other things, and it's really not good for you. Only take it when you have to. And so I tried that, but it wasn't that successful. But when I stopped eating gluten completely, I don't get it anymore. That problem has gone. Mm-hmm. You know, it's amazing. And just, I would say something as simple as eating differently. It's not simple. It's very difficult when you first start, but it does pay rewards, you know, and I'll put my hand up. I'm like everybody. You get bored sometimes, and we have a local farmers market, and there was a lady there who has a micro dairy, and she had a Guernsey cow, and her milk was like 4% of fat, and it was raw milk. There was no, it hadn't been pasteurised or anything. And she was saying that people that can't tolerate dairy can tolerate her milk. She was doing a good sales pitch, but I hadn't had dairy for well over a year. And she persuaded my husband to give it a go, because he had, before he gave up dairy, he had problems on his hands. His skin used to go flaky for maybe 20 plus years. He'd seen everybody, you know, they kept saying to put cream on the top, but the cream didn't sink in. It didn't ever stop the skin. It just sat on the top. Anyway, it didn't work. Going dairy free, his hands cleared up in a couple of weeks. Unbelievable. He'd had this for years. So he wanted to try this milk, and we'd had our grandson with us, and he wanted, this lady made some banana milk. So it's like a milkshake, but it was with real bananas, and it didn't have colourings or flavourings or preservatives. It was all fresh. Well, I like the banana milkshake. I love bananas. And our grandson went home and hadn't taken the milkshake. So my husband said, oh, you like banana milkshake? Try it. So I put a little bit in the glass, about an inch. Oh, and it was gorgeous, Jill. It tasted absolutely wonderful. So I kept going back, just having a little bit more and a little bit more. And then I looked at the bottle, and there was a pint. It was a pint bottle. And I drank half of it. And I thought, instead of keep coming backwards and forwards, it doesn't keep. So I'll just fill my glass up and drink it, which I did. So about midnight, my stomach was gurgling. I mean, literally going glug, 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 glug. And it was keeping me awake. It wasn't painful or anything. But then like 4 o'clock in the morning, I had diarrhea. And it was unbelievable. I mean, you wouldn't really think how many times you can go to the toilet and still have something left inside. And my stomach gurgled for 3 days. 3 days, and you could hear it just going, and it was so unhappy. And if anybody now asks me to drink some milk, there is no way I'm ever going to drink milk again. It was an awful experience, and it's not worth it, is it? So obviously I really can't tolerate milk. And I had SIBO as well, and I've this year, and I've had that sorted out. And Dr. Leonard Weinstock made different suggestions, and I'd been on the FODMAP diet, which is, if anybody knows what that is, a diet that doesn't really include many foods. But I've had a food sensitivity test, and I am sensitive to gluten and wheat and some nuts, some fish, sesame seeds even, yeast, eggs, so many things. Goodness. And that, I know, it's made life somewhat difficult. But before we go any further, we'll have a break, and then we'll come back and answer some more questions. The LDN conference is available to everyone, regardless where you live in the world. Fast internet is required. we have an amazing lineup of LDN experts giving presentations and answering your questions. This is a unique conference not to be missed. You can join us either via the live stream at a time to suit you or in person. The presentations will be available online for 12 months, allowing you to watch as many times as you like at times to suit you. Check out www.ldn2017.com. Any questions, please email me ldn2017.linda@gmail.com. Today's show is sponsored by the Poway Integrative Medicine Centre, who've taken a holistic approach to providing the highest level of healthcare, combining internal medicine with alternative therapies, including acupuncture and Chinese medicine. If you're in the San Diego area, they'd love to see you. Or if you're in the state of California, they offer secure video conferencing appointments when clinically appropriate. Go to PIMCHEALTH.com or call 858-312-1672. On Facebook, follow Jill Cottel, MD's page. Welcome back. Well, that first half of the show went very quickly, Jill.
I would say so. We didn't make it through many of the questions. I was going to ask you, going back to the banana milk, sorry about that experience. That sounds awful. The banana milk, did it actually contain milk in it? It wasn't just made with plain bananas somehow?
It was
a dairy product.
It was a dairy product. It was raw milk, milk that hadn't been pastured, straight from the cow.
Okay. I was going to mention, because I've had patients bring this up before, there's some people who have a sensitivity to milk because they're lactose intolerant. But what some people don't realize is it's the protein in the milk, the casein, that can be a problem for some people. So even the most pure form of a dairy product can still have casein in it. Mm-hmm. It can still be an issue. So.
Well, it certainly was for me. I've learned the hard way.
Yeah, moving on from your, that's terrible. Moving on, let's see. So question 4, it comes from Jane. She says, I have Hashimoto's, and she's been prescribed LDN and is going to start taking it tomorrow. And what are side effects I should look for? And so, Jane, just to reassure you, the LDN's very well tolerated. Most of the time, we don't see any side effects at all. Occasionally, patients, if they take it at bedtime, can get vivid dreams, and that doesn't happen for everyone. And if you do get them, they'll often pass within the first week, or sometimes people will just find them entertaining and they don't bother them. Every so often will be enough to interrupt sleep, in which case you can pull it back and take it earlier. Some of my patients who are prone to diarrhea will get some loose stool when they first start, but that tends to be more the patients who already have some difficulties going on with their GI tract anyhow. And then I've had maybe a handful of patients who've gotten kind of a strange headache when they first started, and that usually passes in the first week. Sometimes will recur when you jump doses again, but overall very well tolerated, and you should do very well on it. Moving on to the next question. Susan would like to know, could LDN possibly help her fibromyalgia, and could it be a benefit at staving off future cancer, because she's already had a bout with some a few years ago. And fibromyalgia, yes, definitely worth trying for that. We've got some good small studies showing benefit. And out of my patients who have fibromyalgia, I would have to say maybe with the exception of 1 or 2 patients, almost everyone feels better to some extent. So not everyone goes into a full remission, but almost everyone feels better to some extent. And then the question of cancer prevention is a good one. I think probably that's a yes, because if we have studies, we have animal studies showing benefit, LDN in cancer, which is not even addressing the question of LDN in people, but just the animal studies. And so I think theoretically on a basis, if there's a possibility that LDN can be used to treat cancer, which is a whole nother topic, then it would just kind of make sense that possibly it could be used to prevent cancer. But again, we don't have the data. There haven't been any studies showing that that's the case. But based on how we know LDN works on cell growth and regulation, it's certainly possible, and definitely a why not sort of thing. Linda, would you agree?
Yes, most definitely. There are many doctors even that are using LDN where there's a history of cancer in the family.
Mm-hmm. Okay. Next question is from the patient, Mary, who has polymyalgia, and she's been on prednisolone, a corticosteroid, and had been tapering her dose, and it got down to about 3 milligrams and flared and can't seem to maintain a pain-free state, and wondering if LDN might help to wean her off the steroid and keep her pain-free after. And I have had patients with polymyalgia where using LDN has enabled them to decrease their dose of prednisone. I have at least one patient who's down to 1 or 2 milligrams. She hasn't been able to come off completely, but it helped her get down to that point. And then I've had at least one other patient who was able to come off entirely. So my thinking would be to add LDN to the steroid and then work on going into a pain-free state. And then once you are pain-free, then tapering the steroid very, very slowly, and then seeing what happens. But there's a good chance that would work.
Mm-hmm. What is the long-term effect of taking steroids, Jill?
There's so many potential complications from staying on steroids a long time, from osteoporosis to loss of muscle mass to diabetes, cataracts. It's just a long list. Weight gain. So there's a number of reasons why it's helpful to get off of prednisone. They're not as bad once you get down to tiny little doses like 1 milligram. It's still concerning.
Mm-hmm. Okay, thank you.
This next question we actually got a couple times. People who have thyroid conditions and are taking thyroid medicine and also taking low-dose naltrexone, and because of sleep issues, they're finding they need to take it in the morning, and then concerned about they also take their thyroid medicine in the morning. And the question being, do they need to separate the time between taking the LDN and the thyroid? And so I would say it's like any other medicine. Thyroid is always supposed to be taken alone, not with anything else, and that includes vitamins and supplements. And I think the usual recommendation is 1 hour between thyroid and any other medicine. And I think that would be sufficient for applying to the LDN also. It might be a better question for a pharmacist, but that would be my take on it. The next question says, is LDN for real? I have found nothing to be a relief. I have fibromyalgia. Yes, definitely for real, definitely works. Lots of clinical experience from different prescribers, from patients, and we have several small studies. So definitely worth trying. The next question is about post-polio syndrome and using LDN for post-polio syndrome. I have very limited experience with this. I have one patient who has post-polio syndrome and chronic pain because of that, and we have him on the LDN for the chronic pain. And it has been beneficial, but it hasn't completely removed his pain. And I think part of the difficulty with post-polio is there's so many there can be so many different types of pain involved, because often people have structural problems left over. So they might have neuropathic pain. They might have pain coming structurally from the spine or joints. So it kind of depends on what the particular symptoms you're dealing with are. But again, it's one of those things where LDN is so easy to use, so well tolerated. It's worth trying because you might get pain relief with it. Let's see. The next question is from a patient with Hashimoto's, and just having started LDN, wanting to know how you can tell if it's working, and a second question about, can gluten ever be reintroduced? The first question, how to know if it's working. For my patients, we usually go by their clinical response, so usually they can tell. I know there's doctors who check antibody levels. My patients, we usually go by clinical response. And then the issue with the gluten, can gluten ever be reintroduced? That's a very good question. It depends on who you ask. And Dr. O'Brien has an entire series on this. I know he's been interviewed with you, Linda. Mm-hmm. And the problem with gluten, even, once everything is good, if you've made antibodies to gluten at some point in the past, they're always there. So if you reintroduce gluten again, you can start making antibodies to it all over again. It's the same principle about vaccines. That's how they work. So is it a never? Possibly. I mean, certainly not in the short term as far as that goes. And I think that was at the LDN conference, Paul Battle was speaking about it too, and talking about, the gluten forms opiate-like peptides, and they're binding to the opiate receptors, and the whole thing is just a mess. It can interfere with how well LDN works. It can stimulate the immune system. So it's better to avoid it if you possibly can.
The thing is with gluten, it's in just about everything. It becomes a way of life initially. Obviously, you need to eat as fresh as you possibly can because there's no gluten in fresh vegetables, meat, nothing that's processed. But if you buy things that are processed, or cans, or anything that's in packaging, if you read it, 9 times out of 10 there's gluten in there. So you have to be a bit of a detective to start with, but then you learn, I can't buy this or this because it's got gluten in, and that just leaves X, Y, Z. But you do get used to it, and it's not as hard. The first 2 or 3 weeks, I think, are the most difficult, but then you settle down. And once you have settled down, you start to feel the benefits and realise it's well worth doing.
Mm-hmm. Mm-hmm. Let's see, the next question. The patient has actually quite a long list of autoimmune problems and some other non-autoimmune problems. And the question is, where can I get a chart to keep track of the changes when she starts LDN? And I was thinking the LDN app would be a good way. And Linda, you know more about that than I do.
Yes, the LDN app is free, and you can have it on a cell phone or your laptop, your PC, your iPad or your notepad or whatever device you have. And if you have more than one device you'd like it on, it syncs. So if you put it on one, it's automatically on the other device as well. And you can track medications, exercise, diet, supplements. You can set alarms. And over a period of time, you can keep a journal as well. But over time, you can then produce a graph and charts and things that you can take to your doctor where it will show. I mean, there are some people with, let me say, fibromyalgia who had been taking 14 different medications. And then over a year period, they could show where they dropped different medications because they were no longer needed. And one lady got down to just 2 medications, LDN plus another drug. But that was amazing to go from 14. But she could actually see by the graph, month by month or week by week, however she wanted to print it out, how she progressed. So that would be really good. And if you go to the LDN Research Trust webpage, which is www.ldnresearchtrust.org, you'll see there's lots of information there, and there's a link to the app.
Thank you.
You're welcome.
Wonderful. I'm going to try and speed up so we can get through more of the questions. The next one, a patient says he has pernicious anemia and rheumatoid arthritis. And how would LDN benefit him, and how would he get it? How to get it, I would say start with your primary care doctor and bring the information that is on the website at the LDN Research Trust. I believe there's a link for paper to bring to your primary care doctor, who presumably does not know anything about LDN, to ask for a prescription. It's the best place to start. How would this benefit me? We know that with rheumatoid arthritis and inflammatory joint disease like that, the LDN acts as an immunomodulator and improves the health of your immune system, decreases inflammation, just the overall overactivity of your immune system that shouldn't be happening. It helps to calm that down. Pernicious anemia is a very interesting thought. We know that pernicious anemia is an autoimmune problem where you have antibodies that are interfering with the absorption of B12. The traditional treatment for pernicious anemia is B12 injections. And so because that's just so easy to do and inexpensive, I don't think, as far as I know, anyone's looked at treating the underlying cause for it. And any sort of, autoimmune or immunosuppressant is not going to be worth, any potential risk when you could just take B12. But could LDN work on pernicious anemia? That's a fascinating question. I'd love to look at that. If we found someone who had just pernicious anemia and nothing else, and we put them on LDN, I'd be fascinated to know if it would help with that. Next question, there's a patient who wanted to know, can you take LDN at the same time as a medication called, let's see, I have it pulled up, Chantix. It goes by 2 different names. The generic name is, I'm going to pronounce this wrong probably, varenicline. It's the medication that's used for smoking cessation. So can you use that in LDN at the same time? Are any of the same receptors involved or affected? I have not had any patients take both at the same time, but the Chantix is acting on the nicotine receptors and one other group of receptors, neither of which are endorphin receptors, which is the primary thing that the LDN is binding. So I don't see there any problem taking them at the same time. The second part of that was, is there any research on LDN and vitiligo? And I don't know of any studies. Linda, I don't know if you do.
No, I don't. But I have heard of some patients who've used it with good success.
Okay. Next question was, can going off and on LDN every few days or weeks cause a problem in any way? She's having some side effects from the LDN and has to come off of it sometimes. For somebody who's been on an LDN for a while and they're fairly stable, going, off of it for a few days at a time, I don't see a problem with that. It's still going to be in your system. I don't think it's going to lose its effects. I mean, obviously, if you flare, you're going to know it. So, it's not something we recommend, but I don't think it's going to cause a problem. Question: would LDN be helpful for this patient who has both type 1 diabetes and alopecia universalis? I guess I don't know if I'm pronouncing that correctly. The case, I've only had 2 cases with alopecia. One of them, she responded not very well, then maybe a little bit, and so far we haven't seen a whole lot of results. I have a second patient who's only just begun on it. There's not a whole lot of experience, although I know, Linda, that you know of a few at least people who have improved
I do.
with alopecia LDN. Yeah.
Several patients I know who've used LDN with great success for alopecia. 2 I've interviewed, 1 man and 1 woman, and they were just amazed, absolutely amazed. One lady, her hair dropped out and she had lost all the hair on her head, her eyebrows, her eyelashes, and she felt when she looked in the mirror she'd lost her identity completely. And she found that she had some other conditions as well. When she looked them up, they were autoimmune. So that led her to investigate and found LDN and tried it. And her hair came back very dark in places and very white in other places, and much finer than it had been previously. And she said she didn't dye it or do anything with her hair because she thought it looked pretty cool. And people were saying to her, "Where did you get your hair done?" And it was just how it grew back. But she was so pleased, her eyelashes and her eyebrows came back and she felt amazing. Her dermatologist told her when she was upset, she was only a young girl and she was in business and she was having to stand up and give lectures and talks. And the dermatologist said that there were some very nice scarves out there these days, and that wasn't the answer she wanted. She didn't actually get any other help. So, fantastic story. But we have to remember, even though LDN works very well for many people, that it's not a miracle drug, it's not a cure, and it doesn't work for everyone. It works for the majority of people, but unfortunately, there are a few people that LDN doesn't seem to work for, whatever they do, whether they increase the dose higher, lower, take it a different time of the day. But that is the same with any drug, isn't it, Jill?
It is. Everybody's different.
Mm-hmm.
Mm-hmm. Well, thank you. The next question is similar to one we had before. A patient with fibromyalgia who's doing very well on 2.5 milligrams of LDN, and just wanted to make sure there wasn't a conflict with her thyroid medicine, which, no, that's absolutely fine to take together. And also the question about taking it in the morning. And like we mentioned before, just making sure that you have that hour in between where you take the thyroid by itself and then wait an hour to take anything else. And the question about morning versus evening dosing on the low dose naltrexone, which we touched on briefly. I know there are a lot of people who are adamant about it being taken at night, but there are some people who say morning is fine. You can make arguments either way. There's a theoretical benefit to it working better at night. So if you have something serious, trying it at night first at least makes sense. But in my practice, I've had just as many patients go into remission taking it in the morning. So, everyone's got different experience with it. Let's see. This is a good question. So, this next question is a patient has Hashimoto's and Sjogren's, and she's doing very well on LDN, and she's now pregnant. And she read an article saying it could be dangerous to take naltrexone while she's pregnant. But her gynecologist actually thought it would be fine, which is great. But she just wanted to get some more information about that. And at the last conference, actually, Dr. Phil Boyle covered this. And he has done his own research, and he had a survey of over 200 pregnancies, and 100 some stayed on the naltrexone and 100 some didn't. And he kept track of all kinds of different outcomes, and there was no increase in any sort of problems. The patients were equally healthy, similar APGAR scores, similar birth weights. So the patient can feel comfortable staying on the low-dose naltrexone as far as we know, and at least according to Dr. Boyle's experience. So I wanted to make sure to bring that up. The next question was about a patient who has, her husband has Crohn's disease, and he's been on azathioprine, an immunosuppressant, and wondering if LDN could be used for Crohn's disease in the same way, and hoping he could get off the immunosuppressant. So we know that LDN is effective in some patients with Crohn's disease. We have very good studies by Dr. Jill Smith, and so definitely worth trying. And Dr. Weinstock would have more information about this, I'm sure. But adding LDN first, making sure he does well, and then tapering off the other medicine is a decision that should be made with the gastroenterologist, I would say. Dr. Weinstock would probably agree with that, but that would be my short answer to that question. There was another question about glioblastoma multiforme, which is a type of brain tumor, and can LDN be used with that? And there's actually a study out of Duke University where they were using LDN in combination with standard therapy. I was just looking for the results of that. I can't find the results. It looks like the study was completed, and I don't know if there were not enough patients or not enough data. I can't find the answer to that. So, but again, it's one of those things where we have a lot of prescribers using LDN for cancer, and it's not typically something we would say, skip the regular therapy and take LDN instead. Is something that would be a complementary treatment, just a tool in the box like you would do. You would use a healthy diet and stop smoking and take LDN and all the things that you would do in conjunction with your cancer treatment would be what I would say. But I'm sure there's many prescribers who have much more experience with cancer, and we have oncologists, I believe.
We do.
That you've interviewed. Mm-hmm. Yeah. So better question for them. And the last question was from a patient who says they have small fiber neuropathy, and if LDN is working to reduce your pain, can you assume that you have an autoimmune disease? Which is a very good question. And I would say no, because not necessarily, because we know that the endorphins play a big role in the different pain pathways. So even if you didn't have anything autoimmune going on and LDN wasn't addressing anything having to do with the autoimmune issues, the endorphins play a big role in pain pathways. And so you could get pain relief from neuropathy just from the endorphin effect of LDN. So I would say not necessarily meaning you have an autoimmune disease. That's my just, thought off the top of my head, though.
Well, you did really well, Jill, and with a few minutes left, so you did remarkably well to get through all those questions.
I was watching the clock.
So we learn all the time, which I think is absolutely amazing. And of course, you're one of the speakers at the conference this year. We're, 2 months' time, and it'll all be over and done with. I know. What is it you're going to be presenting this year? So I've been saving cases. Mm-hmm. I'm very excited. So because I've been involved in the LDN community, I've had patients coming in specifically for LDN because their regular doctor isn't comfortable prescribing it. And so I get to see a lot of cases that I wouldn't typically see in general internal medicine, general primary care. And I've been able to see some very rare illnesses or disorders that I would never have seen otherwise, and have gotten to treat with LDN in them. And so I'm presenting specifically the cases of using LDN for rare medical conditions. Well, see, learning.
It is.
Yes.
And it's very interesting because there's so many, you're going through medical school and residency, you're reading about all these different types of rare things, and so many of the board questions are on rare diseases, and so you're studying all these, and then you go into general practice and all you ever see is hypertension and diabetes and high cholesterol, and you never get to see anything interesting. And so it's never good for a patient to have something rare, and so it's not like a happy thing that patients are wandering around with these, but for those of us who are bored from seeing diabetic patients all day long, it's interesting to see something you've only ever read about, and then you actually see someone who has it, and you get to talk to them and see what it's like and how firsthand, how it's affected their life, and then to be able to actually treat that person with LDN too. It's fun. So I've got that planned, and then also doing a brief summary of looking at vitamin D for autoimmune disease.
That's interesting because nearly every doctor that I've spoken to, they all say the patients need vitamin D.
Well, so I can't spoil the ending.
Okay, we will.
I can't spoil the ending, but that was basically the premise of my talk. Everyone seems to be doing it, but is there data for that? What does the actual data show? What do the studies show? And that's what we're going to look at.
Well, that's really interesting. Well, we're at the end of our show, so thank you very much again, Jill. And can we have you back in a few months?
Absolutely.
We'll save up some good questions for you.
Okay.
Thank you. Okay. Thank you for being with us
Linda.
today. Thank
yes.
you. The LDN conference is available to everyone, regardless where you live in the world. Fast internet is required. We have an amazing lineup of LDN experts giving presentations and answering your questions. This is a unique conference not to be missed. You can join us either via the live stream at a time to suit you or in person. The presentations will be available online for 12 months, allowing you to watch as many times as you like at times to suit you. Check out www.ldn2017.com. Any questions, please email me ldn2017.linda@gmail.com. To listen to individual radio shows and interviews, go to www.mixcloud.com/LDNRT. I'll repeat that. It's www.mixcloud.com/LDNRT. Today's show is sponsored by the Poway Integrative Medicine Centre, who've taken a holistic approach to providing the highest level of healthcare, combining internal medicine with alternative therapies, including acupuncture and Chinese medicine. If you're in the San Diego area, they'd love to see you. Or if you're in the state of California, they offer secure video conferencing appointments when clinically appropriate. Go to PIMCHEALTH.com or call 858-312-1672. On Facebook, follow Jill Cottel, MD's page. Any questions or comments you may have, please email me, Linda, Linda, @ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.